Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Thank you for joining us today. My name is Angela, and we're going to take a closer look into pulmonary hypertension and interstitial lung disease. In a previous episode, we spoke with Dr. Abu, who gave us a great overview of PH-ILD. We also, in that episode, briefly heard from Jeff Spiwak, who has lived with PH-ILD since 2023. They both join us today to continue that conversation. So, Dr. Abu, welcome back. Thank you for being here. And Jeff, thank you for joining us.
Thank you, Angela.
Thank you so much.
And just to recap, I'll allow Dr. Abu to introduce yourself again briefly.
I'm Dr. Abu Homoud. I work at Jersey Shore University Medical Center, and currently I'm the medical director of the Pulmonary Hypertension Center, and I'm involved in academia of the center, and I'm the associate program director for the Pulmonary and Critical Care Fellowship program.
Thank you. And Jeff Spiwak, we heard a little bit of your story in the previous episode, but can you please tell us a little bit more? How are you doing today? How has it been to live with PH-ILD in your daily life?
Thank you, Angela. Actually, I'm feeling pretty well. Thanks to my care team, my daily life, for the most part, hasn't changed drastically, as opposed to what may be happening inside my body with my heart and my lungs. Daily life isn't really changing a whole lot. It basically has to do with the exertion and doing things
Mm,
during the day. The more stressful the activity, the more I feel the symptoms of the disease. I'm able to do most of the stuff that I've normally do, but it's just that I'm more aware now of what I'm doing and how I'm feeling. And the more strenuous the activities, I've learned over the course of time that I need to slow down. I need to take breaks. I need to take some time. There are some things now that also I've learned that I just can't do. Some
okay.
yard work I can't do anymore. Heavy lifting I've left for others to do. But generally speaking, my wife and I are not real exciting people as it stands. We don't do a whole lot. So luckily, I guess from that standpoint, our lives really haven't changed a whole lot.
And Dr. Boo, is that normal for activity? We heard from Jeff that he had the exhaustion, he had that difficult breathing. As you are diagnosed, do you see in patients kind of that activity level changing?
So in a lot of our follow-ups, we typically look at the exercise tolerance for patients as one of our major follow-up points. So
Hmm.
we ask them, are you able to do more? Are you
Hmm.
able to exert more? Is the medication helping you doing more or not? And we keep titrating medications up to the point where our goal is to try to get the patient to the point where they were before they were diagnosed with PH. Now, with PH-ILD, it becomes a little tricky, which in a lot of patients like Jeff, they already have some shortness of breath from the lung disease itself, because ILD by itself without PH can cause shortness of breath.
Hmm.
And PH adds more to that. And it's very tough to tell initially which one is the major contributor to your symptoms. Is it the
Hmm.
PH or is it the ILD? So we try to treat the pH as aggressive as possible, titrate the medications up based on exercise tolerance, and then repeat or screen the patient again for the pulmonary hypertension signs, doing an echo and looking at the right side of the heart. If everything normalizes and the estimated pressure in the lung normalizes, then whatever residual symptoms the patient have eh, is most likely from the lung disease rather than the pH itself. So we kind of keep going with the medications until we normalize all the pulmonary vasculature parameters and then see where we are at. After which we focus on, as I mentioned in a previous episode, pulmonary rehab, exercise programs, because when you are short of breath for a long time, for like few months or a year, you start avoiding some of the activities.
Mhm.
And that feeds into a vicious cycle where you start becoming deconditioned
Mhm.
because you're avoiding more and more of the activities that you're used to because you don't want to feel that shortness of breath, which is expected.
Right.
Uh, and now your lung improved and you're able to do more. The moment you start doing more, you start feeling shortness of breath. But is it because you're
Mm.
deconditioned or is it because of your disease? The only way we go by is by looking at objective numbers
Mhm.
and then telling the patient, then we have to build more on your exercise ability. And this is where the pulmonary rehab and exercise programs comes in to try to eliminate that deconditioning part that happened over time because we're avoiding more exercise.
Now, Jeff, with your diagnosis, were there materials given to you right off the gate to understand PH-ILD?
I was given materials. Like I said, the care team that I'm working with over at Jersey Shore have been fantastic. And I tend to ask a lot of questions, but a lot of the information then goes over my head. So I'm confident. I have total confidence in my team, even though I
Yeah.
might not necessarily understand everything. This podcast certainly is helping with that also
Mhm.
today. But what happens is sometimes in the age of the internet, you start to research a little bit, which I did, and you start to see things maybe that you shouldn't see, or maybe that doesn't have to do with my own circumstances or situation. So I kind of start to do a little research, but have learned not to go too far and listen to my care team.
Yeah, I agree with Jeff. Internet is a wonderful tool where you can learn a lot of things, but uh, a lot of times patients similar to Jeff start looking their diagnosis, but most of the times the internet will show you the extreme, and a lot of times also will show you results to pH but not associated with your specific group. So whatever you read, it might not apply to you basically, and you can access tons of information, and that's where your care team should guide you. We
Mhm.
like patients, similar to Jeff, to ask us questions in our visits because we can guide you. So next time you look up something, you'll be more focused on what you read. And also, if you keep reading into the extreme of your condition, sometimes that actually backfires because the patient becomes discouraged and that will halt our treatment, basically. I believe that the mind will affect the body. If you come in with a positive attitude, I believe we're able to do more, we'll be able to help you more. It's wonderful to educate yourself about your condition, and I encourage every single patient to actually educate themselves about their condition because information and knowledge is power.
Absolutely. And I definitely agree. And I know here at the Pulmonary Hypertension Association, or you may hear me refer to it as PHA, we have resources for patients designed with them in mind to then take that information and bring back to their medical teams to ask those right questions. Before searching on other sites and being scared, we offer the PHA classroom as well as the PH and brochures, which those brochures give not only an overview of pulmonary hypertension, but also some of the associated conditions to PH, which also includes PH-ILD. We have a brochure on that as well. And I know you've mentioned, Jeff, a couple of times the professionals there at Jersey Shore. Who else is in your support network or who is helping you to cope with living with PH-ILD? Because it's a fairly recent diagnosis for you.
Yeah, yeah. My support network consists for the most part of, my wife, my sister lives close by, a couple of close friends that live close by also. They've been very supportive. They understand what's happening. If I need transportation help, or there were a couple times where I was going for a procedure that I needed to have someone else drive to and from the procedure. So I had a couple of friends helping me with that. My wife certainly understands that there are times where there's a limit to what I can do around the house or to get things done, or it might take a little bit longer. So it's been positive with the people that are surrounding me. And again, I can't stress enough my support team, obviously, is my care team. And I like to say that I think I have a positive attitude, and it's because I trust them so much. They will tell me things that may go over my head, but they explain it very well. They take questions from me, they give me advice, and I truly trust in the direction that they have for me.
Thank you, Jeff, for the kind words.
Sometimes, I forget that I have this disease, due in great part because of your care and your direction. And I guess that may be a double-edged sword. I can never forget that I have, somewhat of serious situation going on. But in general, from a day-to-day standpoint, I think I have a positive attitude and sometimes just go on with my life forgetting, what's going on.
That's what we want. We want you to reach a point where your symptoms are very mild to the point where you can go on with your life without being stressed or anxious about what's going on. We're always there, no matter what, no matter how severe the symptoms, even if it's very minor. Our goal is to keep it minor and to make you live like normal life and keep everything at bay for as long as possible.
Thank you very much. And I'd like to add also, texts during the middle of the night or the weekend, I hesitate, but are gladly accepted. So that's another thing that you don't always get from a medical professional. 8 to 5 sometimes, and weekends are off limits, but not with my care team.
Yeah, I have noticed a lot of the medical providers I've spoken with, they are always there for their patients to give advice, to assist. Do you also encourage the family or the caregivers, Dr. Abu, to kind of be a part of this process with the patient, regardless of what stage they are in their diagnosis?
I would love to encourage all the family members to be involved with the patients, again, because the more support you have, the better the outcome and the patient tolerance for treatment, actually. I always love when the family members come and join us because a lot of times the patient themselves are overwhelmed. The family member can be thinking clearly and they ask appropriate questions about the care. And again, some of the advanced medications are infusions and injections, which a lot of times require support from the family members to
Mhm.
help in taking care of the medication and ensure everything goes smoothly in the process. Which that's why I encourage everyone to actually have a great support system. And in case the disease progresses to the point where we require referral for transplant center or transplantation, always social support is one of the first things any transplant center look for because it's an extensive process to go through.
Yes, which I mean, I connect to PHA. If you are near a pulmonary hypertension care center, often they offer support groups. If you aren't able to have that from your family, you can at least connect to other patients who are going through a similar situation as you. Jeff, were there any coping strategies, or how did you cope once you had your diagnosis? Any lifestyle changes that you've done to kind of manage PH-ILD for yourself?
My coping strategy is mainly to be aware of how I'm feeling at any moment and to slow down. As I said, my wife and I are not real exciting people, so we've been able to continue what we normally do. I do food shopping for the house, but I bring my portable oxygen packed
Mhm.
with me. So if I'm getting tired, if I'm feeling a little bit low, so to speak, I have that with me that I can use. We've gone out a little bit on a friend's boat. We went to New York City recently with friends to lunch. So I think it's my coping is basically just to be aware of how I'm feeling and to kind of act appropriately at that time.
I agree with Jeff. Listening to your body is one of the most important coping tools, not to push through severe shortness of breath, having the oxygen on board with you in case you feel very severely short of breath, having a pulse ox with you on board. That's a very good backup plan too.
And there may be low moments, but as long as you can stay active for the most part, adjust as needed, recognizing your body, hey, I need to take a breath or I need to stop for a moment, I think is very, very important. Jeff, that was a great tip. Are there any other tips or advice you would give to those listening with PH-ILD?
I think, as said before, is the main thing is to be aware of your body and how you're feeling. And when something doesn't feel right, not to wait to do something about it, which unfortunately, I hate to say is what I had done originally. In hindsight, this disease that I'm coping with now probably started about 7 years ago. I kind of pushed through it and took a while before I started to seek help with it. So I think the tip is, at the moment that you feel something's not right, don't be, the strong person and try to deal with it. Go get help because as they say, it's better to be safe than sorry.
Absolutely. I think that that's a good point there, especially, as we heard in your story of often we're like, oh, I'm fine. Nothing is like falling to pieces. Nothing is broken. I don't need to go to the doctor. But yeah, we may be winded or these other things are happening. So making sure that you actually pay attention to when the exhaustion with the simple tasks happen. And Jeff, you still seem to be positive and out there. You're going to lunch in New York from New Jersey, right?
Yes.
You are going out on a boat, which very exciting. So how are you maintaining this hope or this positive attitude with your diagnosis?
Well, I think, as I said before, it's mostly my care team and the trust that I have in them. It's something that just is totally over my head. It's nothing that I had dealt with in the past. And just the fact that I feel good knowing that what, how they're helping me and their direction and advice, that that gives me peace of mind to know that although I feel well for the most part, relatively speaking, currently that what the plans are for me for now and in the future, that helps me to keep positive.
Absolutely. Keeping that positive attitude, maintaining that is important when you're diagnosed with anything because if you just shut down and you're not doing, like Dr. Abu says, your regular activities, that can be detrimental for maintaining your health with this diagnosis. Is there anything either of you would like to share with our audience, whether it is how to talk to your medical team, maintain hope? Just we'll start with you that you would like to share to those listening about your experience with PH-ILD so far.
Well, I think just try to maintain your normal life, take it, you know, as given, so to speak, visit your doctors, but try to keep up with whatever your lifestyle consists of and try not to, deviate in any drastic ways if you don't have to.
And Dr. Boo, anything else to add?
I would advise all the patients to seek medical advice, as Jeff said,
Mhm.
early in their symptoms, not to ignore any symptom. It's again better to be safe than sorry. Know that there's always people in similar situation. We always have support groups. We're always there for you.
Mhm.
And PH is growing. The field is growing. We have more treatment coming up in the horizon. So I wouldn't want anyone to be discouraged, lose hope, or not seek medical advice, and to just keep going and know that we're there.
Thank you so much to you both. I really, really appreciate you sharing these words of hope for our audience, which is one of the main goals I have for this podcast is just to let those who are living with pulmonary hypertension and an associated condition that there is hope. There are treatments available, there's research available, as well as educational resources. So, again, just anything that you've heard mentioned today can be found on phassociation.org through our PHA classroom or free store for information. If you have questions, if you're concerned that you may have additional symptoms that resonate with ILD, or if you're an ILD patient and think you may also have pulmonary hypertension, we would want you to reach out to your medical team. And thank you for listening to PH Insight presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insight. Bye, y'all. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.